Well, the COVID vaccine for kids is here. Families lined up for shots in Jefferson County. And while many families are certainly relieved to vaccinate their children, others have a lot of questions.
So tonight, right here on CBS 4 News at 6:30, we are dedicating a special half hour to address your questions about the vaccine for your kids.
We understand it is a sensitive and important decision. That's why we have team coverage to explain key information from our experts. Alan Janae talks with a family about their decision to vaccinate. We have two doctors joining us tonight live to answer your questions, including that man in the middle, Dr. Reginald Washington, Chief Medical Officer at Rocky Mountain Hospital for Children. Want to start, though, with CBS 4's Marissa Armas. Marissa, how's the rollout of the kids' vaccine going in Jefferson County so far?
Well, right now, there's a high demand for these vaccines here in Jefferson County. They've been vaccinating kids for the last 2 days. And doctors say the big message for parents tonight is to be patient.
We're seeing them 100% filled up, and they've been filling up within hours.
Many parents across Colorado are eager to get their kids vaccinated.
We know that for a few weeks here, we're going to have demand that outpaces our supply, and we're seeing that already.
Jefferson County Public Health plans to administer about 1,000 doses of the COVID-19 vaccine for kids in its first week. The county has about 44,000 kids between ages 5 to 11.
Those appointments are taking a little bit longer than, say, someone over the age of 12 or an adult.
While Jefferson County is struggling to meet demand, one of Denver's main healthcare providers, Denver Health, has several appointments available. The hospital rolls out its vaccines for kids on Monday.
So we're offering vaccines in our clinic sites, but we're also offering them in our buildings. And so if you can't get in to see a provider and get a vaccine as part of that appointment, there'll be a little bit of waiting in the first few weeks, surely. But I suspect that before too long, people who want to get their children an appointment for a COVID vaccine are going to be able to do so.
And Denver Health says that they're working with community organizations to make sure that kids in those marginalized groups have access to that vaccine. And some of those appointments are taking a little longer, not only because they're comforting the child, but they're also working with parents to answer questions. In Golden, Marissa Armas covering Colorado First.
All right, Marissa, thank you. Well, joining us now is Dr. Reginald Washington with Rocky Mountain Hospital for Children.
Dr. Washington, thanks so much for taking some time to answer parents' questions. We're going to start you out with this one. And it's a fairly common one. A lot of adults experience side effects after getting their shots. Are there any side effects for kids immediately following the shot and afterwards?
Yes, the side effects are about the same as we've seen in the adult population. Mild soreness in the arm, maybe a low-grade fever, a little bit of headache, maybe some muscle aches, but they only last 12 to 24 hours, and they're very mild. And we encourage parents to give their children either Tylenol, ibuprofen, something like that in normal doses, and to stay away from aspirin. But no serious side effects were demonstrated in the Pfizer trials.
All right, doctor, thanks so much.
We are now bringing in Dr. Rusha Lev. Dr. Lev is representing the Colorado chapter of the American Academy of Pediatrics. Thank you so much for taking some of your personal time to be with us tonight. And doctor, we all know that the age range is 5 to 11 years old for this dosage. So the question comes tonight from a parent asking, it's a two-part question, so we'll just tackle the first one first. A 5-year-old is about half the weight, maybe less, than an 11-year-old, yet they'll be getting that same dose. Is that a cause for concern?
So thank you so much for having me. I really appreciate this opportunity because this is such a great topic to be able to address. The vaccine is approved for this age group at the dose that was found to be effective and safe. In many vaccines that we administer to children, we administer the same dose for babies that we do for 4-year-olds. And so I don't think that's any cause for concern. I think the understanding is that this population is younger than the 12 to 18-year-olds. So they're being treated as a different special population. They got extra time to study the vaccine, and the results of the studies were very good for efficacy and safety.
And the second part of this question, and you answered that a little bit, should an 11-year-old need a larger dose once they turn 12? Is that going to make any difference, and will it change?
Well, of course, 12 to 17-year-olds are receiving the same dose that adults are receiving, and that was based on the studies, and they're being considered more in the adult age group. I would encourage anyone with an 11-year-old to vaccinate their kids now with the current dose that's available to them, because the sooner we can get them vaccinated, the sooner they're protected, and the sooner they're back to doing the activities that they need to do, and the safer they'll be throughout the holiday season with their families. And we as pediatricians are encouraging all families with 5 to 11-year-olds to get vaccinated as soon as they can.
All right, Dr. Lev, one more question for now.
Yeah, this one comes to you from a parent in Greeley.
How do we know what the long-term effects are if we haven't tested, or we don't know enough about, we haven't had it around?
So the long-term effects, how do we know if it hasn't been around very long?
So we hear this a lot in the office because people are concerned, because people love their kids and they want to know that what they're doing for their kids is the right thing. And I'm a parent. I have 4 kids. 3 of them are now eligible for this vaccine and will be getting their vaccine soon. And I feel very comfortable with the safety. Vaccines in general, we give many vaccines to children, do not have long-term side effects. Studies are designed in particular to look at people several months after they get a dose administered to make sure that we're not missing something in the short term. And these studies are no exception to that. But we don't, as pediatricians and as physicians, have concerns about the long-term side effects of this. And we have a lot of data to suggest that there are long-term consequences to COVID, both from getting COVID infection and having a bad case, or from all the mental health consequences for kids missing out on normal life, which we know are really severe. So those are the ones we're more focused on long-term.
All right, Dr. Lev, thank you. Thank you so much, doctors. We're going to have more questions in just a moment, and parents, of course, stay with us.
In about 15 minutes, we'll be talking about the research that was done to get this vaccine approved for the kids. Now, while children generally don't experience severe COVID symptoms, they can spread the virus, and the virus, of course, continues to affect Coloradans of all ages, especially that Delta variant. 72% of eligible Coloradans are fully vaccinated right now. 78% have received at least their first dose. These figures from the state don't yet include any younger children. Colorado moved quickly to start vaccinating children. Hospitals and clinics were really ready to go since they're already set up to vaccinate adults.
CBS 4's Alan Janae reports that decision one family made.
At night hours after his vaccination, 8-year-old Mason and his mom were out on their scooters in downtown Denver. How do you feel tonight?
Good. No pain.
No pain. Mom feels good about it, too.
Great. Yeah, he's fine.
Through the day, vaccinations started up. At the Children's Clinic at National Jewish Health, 10-year-old Asher, a boy with Down syndrome, got vaccinated along with his 8-year-old brother, Auden.
Just so relieved. Just feel a huge sense of relief.
Asher's at high risk due to past lung infections. His mother has spent his life thinking of his health and thinks the vaccine's right.
I think it's just weighing what we know and what we don't know. I mean, I think the piece of the safety that's been established and proven is what gives me peace of mind of making the decisions.
But this vaccine, like no other, has been a focus of so much attention it comes with worry.
You said something like, is that all it is? Is that it?
Is that what you said? Doctors know they need to calm parents.
We need to reach the herd immunity, and certainly vaccinating the pediatric population from 5 to 11 and 12 to 18 will definitely help.
Mason, who has severe asthma, seemed to think it was just a good day.
We're going to hit up Cheesecake Factory right now, right? Having a movie night. And having a movie night.
I'm Alan Janae, covering Colorado First.
That is one cute kid.
I know.
National Jewish hopes to open more clinics for Tuesday and Thursday.
All right, that leads us to another great question for Dr. Washington. So, Doctor, one parent writes, from everything I've read, it seems that severe COVID is extremely rare in children. So what is the benefit of getting a COVID vaccine right now as opposed to waiting it out a while to see how other children respond to it?
That is a great question, and we do hear that quite a bit. First of all, it is true that most children who get COVID will not be very sick and will avoid a hospitalization. Unfortunately, we know that some kids are sick enough to be in the hospital. We've had several on ventilators, and unfortunately, we've had a few pass away. So what I would counsel parents about is that, yes, their child may not get sick enough with the COVID, However, we don't know who is going to get real sick, so why take that chance when we have a vaccine that is very effective and very safe? The other thing I think people need to realize is as long as COVID is out in the community, it will continue to mutate. And even though we now have the Delta variant, we don't know what the next variant's going to be. And is it going to be more contagious? Is it going to make kids or adults sicker? So the sooner we can eradicate COVID from the general population, the less likely it will mutate. So there's several reasons to get a vaccination now.
All right, Dr. Washington, thank you. The Denver Public School District is preparing to set up vaccination appointments at schools.
The phone line that runs through Denver Health opens tomorrow. That number, 303-602-8958, 8958. They'll have the vaccines at the Evie Dennis campus, as well as Skinner Middle School, Garden Place Elementary, and West, Lincoln, Thomas Jefferson, and South High Schools.
Now, other places the kids' vaccines will be available are all 5 Children's Hospital campuses, 7 CVS pharmacies, and there will also be clinics set up at some of the Denver public schools, as well as clinics in Jefferson County, too. We've also compiled a list of locations and in-depth interviews for you about vaccines for kids on CBSDenver.com.
All right, one final question for this segment. This one for Dr. Lev from a parent in Adams County. Doctor, if my kid still needs a flu shot, how do we deal with the timing for the COVID vaccine and the flu shot?
That's also a great question, and I really appreciate that people are remembering that flu is still out there and a big risk in the next couple of months. So the great thing about the recent data is that the COVID vaccine can be given at the same time as other vaccines. So we actually have concerns about kids missing a lot of vaccines during the pandemic. And now that people are starting to come back to the clinic to see us, we want to get them vaccinated. And there's no concern about giving the COVID vaccine at the same time of any of the other vaccines, including the flu vaccine. So we would encourage people to do both.
Doctors, thank you again for your expertise, and to you folks at home, more of your questions answered coming up.
Including an important one regarding heart inflammation in children after getting the COVID vaccine. We're talking about myocarditis coming up. The COVID vaccine for kids has brand new approval, but parents are split whether they will get their 5 to 11-year-olds vaccinated.
That's right, a third of all parents, according to one survey, will wait and see before they get the children vaccinated. The Kaiser Family Foundation found 30% of parents they talked to will not get their children the vaccinations, while 27% of parents want their kids to get the shots right away.
So one concern with the COVID vaccine is myocarditis, or heart inflammation.
It's certainly a rare effect of the vaccine. Research showing it can occur after the second dose. Symptoms can include chest pain and shortness of breath. We're back now with Dr. Lev. Doctor, this brings us to our next question from a parent in Douglas County. Is myocarditis worse than the long-term effects of COVID? These are the extreme risks I feel like I'm choosing between. So, doctor, do the benefits of the vaccine outweigh the risk?
Again, I think that this just gets back to the idea that everyone is wrestling with what's the right thing to do. We want to do the right thing for our kids. And myocarditis has the potential to be very serious. It's inflammation of the heart, or there's something called pericarditis, which is inflammation of the surrounding the heart. And there were some rare episodes of this reported and have been in particular adolescent and young adult men after receiving the COVID vaccine. There were no incidents of myocarditis in the trials with young children, and there's no expectation at this point that we will find that, and they haven't seen that thus far. Thankfully, all the cases of myocarditis that happened due to the vaccine were ones that were not very severe. People were able to be managed with medicines like ibuprofen and sometimes hospitalization for observation, but people recovered. So my answer to that question would be that the long-term consequences of COVID, or the potential to get COVID in the future, or the potential to get COVID and then spread it to someone who could get very sick, are worse than the very small potential for myocarditis due to this shot.
All right, Dr. Lev, thank you. Still to come, as we answer parents' questions about the kids' COVID vaccine, we're going to go through that approval process of the kids' COVID vaccine through the FDA and the CDC.
Trials for the kids' vaccine have been going on since the summer of 2020.
The vaccine had to pass rigorous standards for approval from both the FDA and the CDC.
Back now with Dr. Reginald Washington. Doctor, can you tell us a little bit more about the process to get this vaccine for children approved?
Yes, what happens is that the drug companies submit several children of various ages to various doses to figure out what the appropriate dose would be. Once that's figured out, they expose many more children to the vaccine to see how efficient it is to make sure they're being protected. And of course, at all times, they're looking for side effects. They do it in sufficient numbers. Several thousand children are enrolled in these studies. And so once they complete the studies, they go through a vigorous review process by the government as well as the CDC before final approval is made. In addition, be sure to keep in mind that the process continues even after the release, and all these subjects continue to give
Dr.
data
Washington,
to the government.
we're going to have to cut you off here. Thank you so much for being with us tonight. Dr. Lev, thank you for being with us. We'll be right back.